Welcome to Inside the Vault, Enterprise Bank's podcast series where we talk about items of interest to the small business community. Today, we're going to talk about a topic that is relevant to our business owner clients as well as their employees, and all of us as individuals who are eventually, hopefully, going to retire from our careers someday. With me today is Rich Inman. Rich is the president of Inman Medical Insurance Connections. Welcome to Inside the Vault, Rich.
Thank you for having me.
So what we're going to hopefully do today is try to demystify Medicare and some things that both business owners, their employees, and all of us as individuals need to be aware of. So before we get into talking about what I consider to be a very nebulous topic, and I'm usually pretty well prepared to discuss business topics, but Rich, I got to tell you, I'm a novice in this area.
You're not alone. Trust me.
So looking for a good education. But before we start talking about that, Rich, can you give us a little background on yourself and your company?
Sure. It's interesting. I've had a varied background, Dave, which sometimes I thought was a negative, but I think it's a positive now because I think I can relate to almost anybody in any industry, any walk of life. Western Pennsylvania, born and raised, Mercer County. Both sides of my family go back pre-Civil War. They're kind of like the Hatfields and McCoys. You know?
Right.
And so anyways, I was a rebel. I moved an hour south, and went to Robert Morris. I'm sporting the colors today here for anybody that's on the video too. RMU, go RMU. But it was college back then.
Right.
Met my wife there, my future wife, and actually, one of my sons went there too. So, anyways, raised three wonderful boys. They're all in the area. We're very fortunate. Two are married. We have two grandkids now. Career path wise, I was a finance major at RMU. It got out. I actually worked in a stock index CD for Mellon Bank back when Mellon was a bank. You remember that? Our young engineer does not. But I worked in a stock index CD. It made me sound smart. Had a part-time job selling. Still got it. Hey, I got to use my degree, right? It kept evolving. I'm like, boy, part-time, I'm making more in sales. And I really liked it. Became a people person. Worked in various industries, primarily in the real estate world. I sold real estate for quite a while. And then if you ever see a house that has a home warranty on it, I was the number one rep in the nation at one time. I was consistently top three. We had a large, I had Western Pennsylvania and the entire state of West Virginia. And that was the mid-2000s. And you're familiar with what happened to the real estate world in 2008.
Oh, a big-time crash, great recession.
You make it to the top of something, and it's a bad thing. Who's getting paid the most, right?
Right.
So anyways, bounced around, was in the limousine business. Started Rich Business Connections, which I still have to this day, doing some leadership training and sales training, various business coaching and so forth. Had a couple other roles where I was, kind of like contracted out to help train sales for teams and everything. And I said, I took my own advice, Dave, for my Rich Business Connections. I said, every once in a while, you're caught in a day-to-day, you need to look up and see what's going on out there. What's the landscape? What's going on? What's the trends, et cetera. Well, I have a friend that was in the medical insurance business. He just sold his business, did pretty well. Really liked the Medicare business. Took me golfing, had a couple beers. We talked it over, learned kind of the ins and outs. And I said, this is a great industry to go into. First of all, there's a need. You mentioned it correctly in the beginning. Number one, it's confusing, but number two, it's pertaining to everybody. 98.6% of the people over 65 qualify for Medicare. You're going to get it. We have a population here that's
obviously you're in the right demographic in Western PA.
right demographic, and I'm approaching there myself, Dave. So a lot of my friends that
so am I.
Yeah. I think I'm a year or two ahead of you, man. I'll let you know how it is. But anyways, hey, we're approaching that, so it's an easy conversation in that regards. And we'll go into the structure and how I operate and everything. But really, the nice thing is I'm more educating. I'm more of a counselor than a salesperson. It's something personal too. You're talking about people's health care,
right?
It's something they're going to need. There's no way of avoiding it somewhere or another. and today's connotation on it, they've changed the whole from hey, this is a negative. This is just something you need if something bad happens to no. A lot of the programs that we have today in Medicare are geared toward wellness, fitness and prevention, and it's more of a positive feel because I think you'll agree with me. Um, Maybe it's just because we're getting to that age, but if I remember my grandparents being my age, they weren't nearly like us. Now I could lose a few pounds and everything
Hmm.
like that, but as far as activity and our health and the availability of what we have, it's quite different. Seniors live to be more vibrant
I
now.
like to think 60 is the new 40.
Yeah. It changes every time I get close to it,
Right,
right?
right.
Yeah.
You keep bumping it ahead.
Right, right. Nothing wrong with that.
Yeah,
Kick it down the line.
yeah.
So that's how we arrived, and it was kind of a whirlwind. The intimidating thing, Dave, was I hadn't studied in years. You have to pass tests, right?
Right.
And you go into that, and for the state test, you only need a 70 to pass. I got a 90. They told me I overstudied by our friends that were in the industry. I said, I was not taking any chances.
I got you.
But anyways, so here we are. I formed a right, and I decided to become a broker. And I work for somebody because one of the powers I have, I do have my name just from raising kids,
Right.
coaching baseball for 17 years in the area, and knowing so many people. I wanted to have my name in it. I wanted to build a book of business that could be kind of a legacy, down the road.
Yeah. So let's try to eat this elephant.
Yeah,
And
yeah,
let's talk about Medicare, the base program.
sure.
So can you give, our viewers and
Yeah,
listeners and me kind of what's the history of Medicare,
sure.
what's the status of it, and then we'll get into all the different options that are available to help ease into that.
Yeah, so Medicare itself was not signed into law till LBJ in 1965, but believe it or not, it was brought up as early as 1916. Then we had a war, we had
Hmm.
presidents die, we had presidents change, we had Congress change, and so forth. And if you think back then, we didn't even have Social Security yet. There wasn't that many government programs. Everything was more state run,
Right.
localized, right? People started getting to that point where they started living a little longer. They actually had retirement plans. So finally got in the 1930s, and FDR with the New Deal and so forth was pushing a lot of the programs through, and they decided, hey, let's do Social Security. They started that. They thought it would be too much with Medicare. Also,
Okay.
back burner again. Another war happened, World War II.
Yeah.
Changed presidents, so forth. Anyway, signed in 1965. That's the government program. There was really several changes, but nothing major until about 20 years ago when they opened it up to private entities. The carriers in the area, the Aetnas, the UPMCs, the Highmarks, et cetera, to go ahead and facilitate programs. But when you talk, there was the term you used, original, the base
Yeah.
Medicare. This is how people get confused. And sometimes it's unnecessarily confusing, I think. The base one is if you hear these terms like Part A and Part B, that's the original government program. There's basically two sides. There's A, which is basically the hospital side of things, and B is if you think about going to doctor's appointments.
Okay.
There's lots of minutia, lots of details. You think of it that way. That's something that you get, when you sign up for original Medicare, you have that base coverage right there.
And when are
Mhm.
you eligible for that base program?
Yeah, good question. Most people, you think of it as 65. It's when
Hmm.
you're 65, you're going to become eligible of it. Now, just so you know, you can enroll 3 months either side of your birthday month. So if your birthday was, in the middle of July, you can go 3 months before, 3 months after. So it's not like that day.
Hmm.
And then you're eligible. You go ahead and sign up. That's the majority of people. Okay. The other subset of that would be anybody that has special needs.
Okay.
There's some categories like end stage renal disability. There's different disabilities. Basically, one of the rules of thumb is if you qualify for Social Security, you're going to qualify for Medicare.
Okay.
That's
So
a
similar criteria.
general rule of thumb.
Okay.
Matter of fact, Social Security is still involved in it. They actually administer Medicare, oversee it, and actually over the payments go through it because there is a premium for it
Hmm.
for even the original one.
Right.
For most people, it's only about $185 a month.
Okay.
somewhat income based after that over a certain amount. But for most
And
people,
that
it's
gets
just
paid out of their Social Security?
yeah. A lot of times it's deducted immediately. Then you could talk to some seniors now that are maybe 75, 80. They've been on for a while, and they might not even be aware if they haven't looked at because everything's taken care of for them. It's just taken out right now. So
Mhm.
yeah,
So, you got the base programs. What kind of
right.
coverage do you get with the base Medicare
Yeah,
programs?
you get so the hospital care, and then the doctor care. Now, there's different ones. The hospital one, just so you know, there's no premium on that for most people. There is a deductible. It's about six. I think this year it changes for the year.
Right.
I think it's a little over $1,600, 1676. I believe they get it to the dollar.
Right.
Government they get it right there. So, by the way, this is overseen by the federal government, but then also, there's a state element to it, especially if you get into Medicaid, which we can get into later. The Part B is the premium for most people, like I said, is about $185. But then you have co-pays, co-insurance, etc., and then it caps out. There's different coverages depending on where you're at and what the
Mhm.
doctors are. But that would be normal things like doctor's visits and actually back to the Part A, you can have skilled nursing covered, and there's a lot of criteria,
Mhm.
days and so forth, and what it covers, and um, but it's pretty good,
I
solid
was gonna say,
coverage.
generically,
Yeah.
for us working folk
Yes.
that have, regular health insurance,
Yes.
how does the coverage like a standard workers, health plan compare to what they'll end up with in the base Medicare programs?
It's close. The nice thing is about it, you can go about anywhere in the country. If you have Medicare, you're not in a program, you're not in a like an HMO or anything like that. You can go anywhere that they accept Medicare, which is just about everywhere. So you could travel. It's very attractive for that reason. It's going to be accepted. You're going to have coverage. There's no health examinations or anything like that. You're going to get it.
Okay.
That's the advantage of it. You're going to have very similar compared to a private plan that you would have
Mhm.
through an employer. There were some holes,
Okay.
and that's what kind of it led into. If you hear the different terms, the Part C
Yeah.
and the private entity, that is Medicare Advantage. And if you're turning 65, you'll know that term all too well because you'll have lots of friends. All of a sudden, you'll have lots of postcards and calls, and you'll see lots of commercials. All of a sudden, you'll be paying attention to them on Medicare Advantage. Those are administered by the private entities that I mentioned before, the carriers.
Okay.
Government realized that, hey, again, things evolve. Remember, we're going back and we said, hey, maybe there is a need for some government support. Let's start talking about it. Then they finally signed in Social Security, then Medicare, right? Then they started realizing, well, people started living even longer. There started becoming more needs, and the medical industry became larger, more complicated, more sophisticated in many ways, right? So there were some gaps. And a lot of people have heard the term Medigap. Supplements, Medicare Advantage. You ask if there's the
Is that
same
all the
thing.
same thing?
It's not. It's
Okay.
not, but it's very similar. What happened was
All right, let's
that
let's break it down.
those were created to fill the gaps, if you will, that were left by the original Medicare. Original Medicare doesn't cover things like dental, vision, hearing. A lot of the programs that you're talking about with Medicare, Medigap, or what they call supplemental,
Right.
those are implemented by private carriers, still overseen by
By
the
the
government.
government. Okay.
So there's a little bit of like kind of best of both there. So you're getting a variety. You can choose and see, hey, what plan's best for Dave? But you have government oversight on the regulations, and it's like, okay, I know it's okay. In fact, in order to get one of those programs, you have to be enrolled in the original Medicare first.
Okay.
That's the rule. You have to be enrolled in original Medicare. Little caveat. Let's go back real quick on the timing there, Dave. What just recently happened, and I got caught up in this, and you did too. What just happened to Social Security? When can you get it? The full Social Security.
What is it, 67 and a
Yeah,
half?
yeah, yeah. They moved the line, right? It used
Right.
to be 65. So it was automatic. It was like, and most people were in mill work or whatever like that around this
Mhm.
area. So it was automatic. Hey, it was right at 65. You retire, you're in Social Security, you were automatically enrolled in the original Medicare. You didn't really have to think about it. You just got it. Got your Medicare card. Here it is. Well, now, this gap, you're still eligible for Medicare at 65. you're not taking your full Social Security yet.
Gotcha.
Okay. So they have to proactively, if I talk to somebody and they say, hey, I'm holding off on that, I am retiring, I'm holding off on that because it's a little bit more money I can make do right now, or I have a spouse that's working or whatever. But I'd like to get my Medicare now. So then they have to proactively enroll in parts A and B. I have to make sure that they do that before I can show them one of the plans that's a Medicare Advantage plan or so forth. Once you get on Medicare Advantage, though, Dave, you have that card from that carrier.
Hmm.
You can leave your original Medicare card at home. Don't throw it away.
Yeah.
It's kind of like a Social Security card.
Right.
Leave it in your drawer. But they know when you go into a hospital or a doctor or go get your vision checked or whatever, you have that card from the carrier. They're saying, hey, this person's qualified. They've gone through it. They've already enrolled in
Yeah.
original Medicare or base Medicare, as you put it, parts A and B. They're eligible for this. They're in the program.
So these supplements
Yeah.
are available at age 65,
Yes.
and or if you fall into other, let's call it qualifiers for Social Security that are similar, like
Correct.
based on your health condition or developmental issues, those types of
Right.
things, right?
Well, what you're referring to right there on the eligibility, that's Medicare itself.
Right.
As far as the supplements or the Medicare Advantage, you can get that later if you wish to. That's another caveat to that. So some people may have signed up just for the original when they were
Right.
65 and they had it, and they said, 5 or 6 years into it, they're realizing, geez, it doesn't cover anything. I need hearing aids. I need this and that. I need these copays. Boy, they get up there. That's when you would call in and say, hey, you can switch. And there is a time you can do that every year. There's an opportunity to go ahead and change. That's what's nice too, Dave. It's not a set and forget it for life. You can
And I'm
be,
assuming because it's
yeah,
handled at the private carrier level,
yes,
that you kind of got to pay attention to what the changes in the
yeah.
coverages are and the supplementals from year to year, correct?
That's an excellent point, but that's where I come in because most people don't pay attention.
Okay.
As usual, they're required to send things out, right?
Hmm.
Notification that there's been changes or whatever. But most people don't understand. I'll give you a great example, Dave. Have you ever heard? I talked about parts A, B, and
Right.
C. Well, there's also D. D is a big one because that's prescription drugs.
Okay.
No matter how healthy you are, eventually most of us end up on some kind of prescription drug. This is a classic story. What happens is, they're on Medicare and years 1, 2, 3, and 4 every year. It's covered. It's covered. It's covered.
Right.
All of a sudden, year 5, they go in to get their prescription drugs on in January. 'Cause that's the new year, and they go, "It's how much? Wait a minute." They get caught by surprise. They were sent a notification, so forth. That's what I do. That's where I come in. My team, we would come in and go, hey, be a little proactive. Just to let you know, Dave, that prescription drug that you've had for a
Not
number of
gonna be
years,
covered. Yeah.
it's not going to be covered. So we have two options at that point, right? We can go back to your physician and say, hey, is there an alternative that we cover that would be acceptable? No. If not, I can look for another plan for you.
Okay.
No, Dave has to have this one.
So
We're gonna-
Medicare A and B is Medicare A and B.
Yes.
But these other C and D plans, they'll vary based upon the provider.
Correct.
Gotcha.
And there's a lot of them. It's like if you go into a restaurant these days or go grab a beer or food or burgers, I don't know about you, they give you 6 menus now. And there's a gazillion and it's overwhelming. That's like that. Like I personally have 34 plans. So, there's a lot to choose from. And that's what we do is kind of whittle away, through the weeds and get down to what's important for you. There's what's called an annual enrollment period. So we talked about when you become eligible to begin with. That annual enrollment period is basically the fourth quarter. It's October 15th to December 7th each year. So we're the opposite of CPA. CPAs don't sleep during the spring. We don't sleep at that time of year. But that's your time to go ahead and say, hey, is there a time we need to make a change?
Mm-hmm.
Or I'd like to, or maybe they're on original Medicare and they'd like to change to a Medicare Advantage plan, whatever. That's the time to make the changes because the plans generally run by the calendar year. So you want to be in place for January. You want to know what you're getting into.
So generically,
Yeah.
what are the differences in cost when you go into an Advantage plan?
Believe it or not, sometimes you can really make out. And I'm going to tell you the number one thing you have to be aware of. Original Medicare, does not have a maximum amount of pocket. That's the scary thing a lot of people don't know. So something happens, you know how fast you can get $30,000,
Right.
$40,000
Medical
bill
bill.
pretty
Yeah.
quick. Pretty quick. There is no maximum there. Most of the Medicare Advantage plans through the private carriers, they do. They
Okay.
might be $6,000 for a year, $7,000.
But it's not the catastrophic level you could experience with just base Medicare.
Correct.
from
It's
an
not going to wipe
out-of-pocket.
you out.
Yeah.
That is the number one thing I like to point out to people. But then, as far as costs, a lot of the plans that I cover, they actually have a zero premium. Some even have cash back toward because you're paying for that Part B. Remember,
Right.
that's taken care of on your Social Security.
Yeah.
And by the way, this is not like a welfare program or anything like that. You've been paying into it all your life. So this is it's coming
Mhm.
back to you, if you will. Okay. So when you go in, sometimes they'll give you a little cash back. It's something minimal. Sometimes it's
Yeah.
like 10, 15, $20, but it's nice.
And that's even from going to an Advantage plan versus the base, depending on your circumstance.
Correct. So
Gotcha.
you actually are now paying less, but then you have, obviously they do have like co-pays, co-insurances and so forth, but they have top offs. Part D, the pharmaceutical or the prescription drugs, that's often separate from like I said, the maximum amount of pocket for the
Right.
medical. That's a separate category. And that just recently changed. It changes every year. That's another reason why you have to have somebody on your side, because the numbers change every year as to what that is. What's the maximum amount of pocket? But it's like any other, like kind of like the insurance you probably have now, where you have the copay.
Right.
You have a deductible,
Yeah.
and then you have the copays and co-insurance that goes up. The big thing they've added recently, though, is what I mentioned before about they've made this like, hey, this is just isn't something that goes wrong. Let's take care of things proactively. A lot of the programs in the Medicare Advantage programs cover like preventative dental, vision, hearing tests, things like that. And they'll even cover like your eyeglasses, contacts, hearing aids up to a certain point. Pretty good coverage, but then they also have things like, well, incentive advisor, we're going to give you this spending card. It's kind of like a card
Yeah.
that you can spend on things like over the counter health things for fitness club.
Mhm.
They want you to be healthy. Smart. If you think about the medical system, they get overrun as it is now. Boy, if we can head off somebody's potentially, they're headed toward that catastrophic medical condition. If we could head that off,
Lowers the cost for everybody.
better for everybody.
Yeah.
Better for, yeah, they're looking at cost. Obviously, we want to be
We wanna
healthier.
live.
Right? We want to live. I
Yeah.
find that's a good plan.
Right. So-
yeah.
So how does Medicaid play into this?
Medicaid is more primarily income based.
Okay.
Now, just so you know, that people think that they're separate from Medicare, but they can often go along with a Medicare program. But it's income based, and I can't tell you the
Yeah,
charts or anything
right.
like that. But that's up to them to. The government does that. They do like you're eligible for this, you're eligible for that. But they can work in conjunction with Medicare.
Okay.
Yeah, so we do have those programs. There's lots of other programs, for special needs, like I said, and for children and so forth, and people that are under a certain income level, if you
Right.
will. So, yeah.
So let's bring this back around to our target audience,
Yeah.
which are business owners
Sure.
and/or their employees.
Yep.
So if I'm a business owner, why is this important to me?
Okay.
Because I want to take care. I have my own retirement and my
Right.
own health, long-term
Yes.
health to deal with, but I want to basically be sure my employees are taken care of when they're nearing retirement age. So walk me through, what would be smart for
Okay.
a small employer to be sharing with their employees that are nearing retirement age.
Yeah, and you sound like a good guy to work for. You care about that. That's good. So, really, yeah, if somebody's like that, especially I find that's more prevalent in the smaller businesses too, because they get to know their people.
Yeah.
It's not a high turnover. You get to know them. Somebody's
Right.
been there 20, 25 years. They become like family to you. You probably see them more than some of your family if you have a
Right.
small business. So you want to take care of them. It's that transition. It's the transition and the retirement. And as I indicated before, the full Social Security is a little bit different than when you are eligible for Medicare.
Okay.
So it's really about the education and how you make sense of that. The other caveat to that could be, Dave, that maybe the person wants to keep on working to a point. They can actually still have their existing coverage through their employer as their primary and Medicare as their secondary. It's like a
Oh, I
backup to
didn't know
fill in
that.
the gaps. Yeah. And there's different, every situation's a little different, but that's an interesting little caveat that you can have there. Or somebody wants to go part time, they pull back and say, hey, the reason or they want to retire.
Hmm.
The reason I'm hanging on because the benefits here. Well, hey, there's an alternative for you right now. Make it
I didn't
smooth for
know
you.
there could be an interplay between private
Yeah.
insurance and Medicare when you're eligible for it.
Yeah, and it's constantly changing, mostly for the better. They play nice in the sandbox together. So, and one of the other reasons I would say, think about. I was talking earlier to somebody about um, senior services. There's a catalog. There's a directory. As a matter of fact, I'm involved in. It's called Seniors Blue Book. Little plug for them out there, but
Yeah.
it's kind of like a go-to resource for anything senior services in our area. There's a web version and there's a catalog. I was talking to the owner, April Gare, and she said actually one of the people that take literally even the physical copy, believe it or not, you don't think of people doing it. They're all over in the stores. They have thousands of copies go out, or 40 to 50-year-olds. What are they doing? I'm doing it now with my father. You start becoming involved in your parents.
Right.
Can we help them out? So you might have an employee that's kind of like distracted, a little bothered and everything. What am I going to do? I don't know what to do with my parent. Here's what's going on.
Right.
Spouse died. It's always the spouse that handled all the finances and everything that passed away, right? And
Hmm.
it's the ones out, fish out of water. What do they do? What's going on? Here's a little peace of mind. Let's get some guidance and get you in. Take care of things for your parent. So it's also, when you provide anything like that, you show some care.
Right.
That's attraction
That's a
and
loyalty
retention.
factor.
It's
Yeah.
a loyalty factor. And that goes a long way, especially in a small town like Pittsburgh. Everybody knows everybody, right?
Yep.
Your reputation, it's golden. It means everything.
Right. So, what would be the process for somebody that's nearing retirement age but
Hmm.
isn't eligible for um, either Social Security
Hmm.
because it's trails Medicare at this point by a
Right.
couple of years,
Right.
and or Medicare itself when they're ready to jump onto that
Right. It's not
program.
bad to educate yourself ahead of time, Dave, but it's probably not as important as, like, let's say your financial planner or talking to your private banker or something like that,
Right.
where you should be planning maybe the sale of your business or transition
Right.
years ahead of time. It's not that advanced, but the nice thing is actually we do work well with those professionals also, the estate attorneys, financial planners, CPAs, bankers, etc., because it's very important on their entire picture, if you will, because they got to know, hey, are you going to be a snowbird? Are you going to move? And that the plans are regional.
That's right. Yeah,
You have
'cause it's
original
private.
Medicare, but there's
Yeah.
regional ones. So hey, that's important. We need to know when you're here, what kind of coverage you're going to do. How does it impact your finances? Because there is a variance of programs. I mentioned I have 34 myself. So, um, how's that all play into things? So, but as far as the actual people themselves, when they're getting to that age, I, it's not a bad idea to know what it is at 58, 60 years old, but
Yeah.
until you're right there, you should probably, because they change all the time. I guess that's
Right.
what I'm trying to tell you. You should know the basics, but the actual particulars of the plan or thing, really just maybe 6 months ahead of time.
Okay. And what about those people that are Medicare eligible and on Medicare? What should they be doing
Hmm.
to make sure that they've got the program scope of services and cost management that they need?
Yeah, great question. As we've talked a lot about the people turning 65
Yeah.
and special needs, but there's those people that are already on it. They've been on 10,
Yeah.
15 years. And they might have the best program, they might not. Believe it or not, there's even military people. You think, well, you're in the military. It's not all the same. We have military programs, and they are different. I got one the other day, and it was a substantial difference on the coverage and what was going on with his therapy and so forth. Um, so get it reviewed. That's the thing.
Right.
That's one thing you're not going to get generally unless you do
From the health and carrier themselves versus you as an independent broker.
correct.
how do you go in and
Yeah.
assess things for your
Yeah, and just so
clients?
you know, the nice thing is I mentioned you're going to get it anyways. You might as well
Yeah.
have somebody on your side. They don't pay for my services. I'm a broker. I'm not beholden to any one carrier. I'm going to come in and be a true advocate for you. So that's why I'm going to be proactive and review that. We gave the example earlier about the
Yeah.
medication that was no
So
longer
I'm
covered.
assuming you sit down with your clients
Yeah.
and say, all right, what are your,
Yeah.
existing health issues?
Yes.
What are your future concerns? What types of medication are you on? And then you try to find the best.
Well said. Yeah, I could hire you, Dave. Yeah, right, we'll go golfing every year. Yeah,
Right.
yeah, yeah. I'll go golfing while
Yeah.
you're
Yeah.
working out. Yeah. But that's it. It's basically a question. Hey, what's going on with your health? What do you anticipate anything coming up?
Right.
Like some people know that I'm getting my hip replaced
Right.
next year. That might change the plan. Because we might lower that maximum out of pocket or whatever we weren't going to do.
And considering those open enrollment periods, when should people start looking at that?
Yeah, again, if it's age, what's called an age-in, which you're going to be turning 65.
Yeah.
So the people that were born 1960 for this year, they should be all looking. And again, it's 3 months either side. It's not like a deadline. There
Right.
is something that people come up to me and say, "Is there a penalty if you don't sign up?" There actually is.
Really? I didn't
Yeah,
know
believe it or not, because you've been paying into it all your life. And you say, "Well,
Yeah.
why it's a benefit? Why wouldn't they like that if I didn't take advantage of it?" Right? No, they want people that, hey, you've been paying into it. It is a program. They're like any insurance. They've calculated as to, this is what it costs. And this is
Actuarial
the
tables, yeah.
actuarials. Yeah. Yeah. And what it is, if some people, a decent amount of people don't enroll at that time, it throws off the number because they're assuming that, 98% of the people that when they turn 65 are getting into it. And then here we go. That's how we come up with those numbers.
Okay.
They would probably go up because if you think about it, somebody doesn't get it at that age, unless it's because they're active and they're working, but they don't get it, they just let it slide, or I don't know. Then all of a sudden they're getting it. It's almost like the people that I was just in a car accident and they call up, "Can I get car insurance now?" Not quite like that, but kind of like trending that way. And so it's probably going to it would probably raise the numbers and everything. So that's
Gotcha.
why there is a penalty if you don't do that. Now, the exception to that is, you mentioned employers. If somebody is still working, if they have what's called credible coverage through their employer or through their spouse, that's an exception. You have what's called credible coverage. It's
Then the government's not going to
right.
supplement.
Now, once you stop that, okay, let's say you retire at 69, 70, now you have, I think it's like a certain time period, like 8 months or something like that, then to go ahead.
Credible coverage. Yeah.
You post credible coverage. That's a great term.
Okay.
Yeah.
So, how do either people that are already Medicare eligible or on Medicare,
Yeah.
or those that are turning 65, how do they get in touch with you?
Well, first of all, I always have to do the disclaimer. You can always look on Medicare.gov too
Right.
for any information. That's what's nice. But I have my own website, Inman Medical, and I'm on LinkedIn. You can call me 724-316-8802. It's really a conversation.
Right.
David, starts as a conversation.
And again,
just
this
like
is no cost to
No,
the client.
no, you're getting it. You might as well have somebody on your side because
Right.
obviously, if you call Big Brother XYZ or whatever, they're going to say, "This is it," right?
Yeah. They have their captive plan. If you call the carrier versus you can look at all the programs that are available.
Right. I'm going to find out what's. Hey, and every once in a while, Dave, I might say you're
You
better
got-
off staying on original.
Yeah.
That's the way it is.
Yeah.
It's just better for you. And it's nice for me because it's a very individual thing. I'm used to doing B2B business.
Right.
Even though I'm hoping out the businesses here, I'm also doing some, it's very personal as opposed to, I think some property and casualties become a little bit more like, I know my kids.
Yeah.
They become more like, it's $5 less. I'm
It's
switching.
commodity.
Yeah,
Yeah.
it's commodity.
Banking's becoming the same way.
I know you're battling it. And actually, you guys do a wonderful job here.
Yeah.
I a little plug for you guys.
Yeah.
I mean, I like the way you have like the Marcus Welby type,
Yeah.
where your people get in there and they hold the hand through all the phases. I think that's fantastic.
Well,
what you do.
and that's why we're having this conversation. I
Yeah.
mean, the bank, in addition to being a bank and a lending organization, we want to provide value add.
You certainly do here.
For our business owner clients, and in this case, for their
Yeah.
employees. So, with that said,
Yeah.
thank you very much for
Yeah.
kind of demystifying some of
I'll
this.
try because that's
confusion.
number one thing I hear, Dave, is when I say it to people, even professionals, they go, the next thing out of their mouth was, "It's complicated."
Yeah.
And so
And I think it's great
Yeah.
for those that are seniors that might not understand all this. There's people like you that can kind of break through the confusion and explain it to them in layman's terms and
Yeah.
customize it for their particular situation.
All starts with the conversation. We can have over coffee or on the phone, and then go from there. It's usually just so you know, back to the
Yeah.
procedure. It's painless. I ask those questions. I'll probably come up with out of the 34 plans. I'll usually come up with, hey, there's 2 or 3 that I think are real good. Then we'll meet in person. We'll go over them and do like a side by side. And here we go. And it's still your call at the end of the day. It's still
Right.
your call on what to do. But I just guide you and get you on through. The enrollment process is a piece of cake.
Yeah.
Go from there. So
Great approach.
Yeah.
Again, thanks for the info.
yeah.
For those
Thanks,
of
Dave.
you that have any questions or ideas for future episodes, you can email us at insidethevault@enterprisebankpgh.com. You can check us out in audio format on all the major podcast platforms and in video format on YouTube. Rich, thanks again for
Thank you,
joining us.
Dave. Get out and golf. It's nice today, finally.
Sounds good.
All righty.
Thank you all.
I know.